I'll just introduce myself. I'm Sen Shukla. I'm with the Gerstein Crisis Centre, which is a mental health organization in downtown Toronto, but we've recently expanded out to the east of Toronto and a little bit to the west. I am a program manager, and I've been with the Gerstein Centre for about 18 years in different capacities, from crisis worker, so frontline work, to data management, and now to management of various programs within the organization. And I'll throw the floor over to my colleague, MTS, to introduce himself.
Hello, everyone. Thanks, Sim. Yes, my name is MTS Merceline. I am the Taibu TCCS crisis coordinator for the Northeast project, which is the entire region of Scarborough. I am the coordinator since the inception of the program, which started in 2021. And I am now continuing in many other capacities, but I'm happy to be here to help present on the information about this much needed and long overdue program known as the Toronto Community Crisis Service. Thank you.
So I hope everyone can see my screen. So we're going to be presenting on the Toronto Community Crisis Service, but before we go into that, I'm just going to give you a really quick high-level overview of what the Gerstein Centre is. So we've been doing this work for a long time, since the late 80s. We're a police alternative to crisis response. And so what happens is our Gerstein Centre, if people are having immediate crisis in the city of Toronto, they're welcome to call our 24/7 line. There you are connected with a crisis worker who can help walk you through a crisis situation that you're currently experiencing on your own, like if it's regarding yourself or a loved one, family member, a colleague, anybody really, as long as you're over the age of 16. So we have two direct lines, our crisis line number, as you can see on the screen, as well as we have 988. We are one of the partners in the National Suicide Prevention Line. So we do have trained crisis workers that are able to receive those calls and walk somebody through their crises. And also attached to the service is a mobile team. So our teams can come out and see you, come out and see you, and crisis workers can meet you in real time and really walk you and guide you through your crises. As well as we do have some crisis beds attached to our service where folks can get a little bit of a respite for 2 to 3 days, kind of regroup, get the support they need in-house, and then are able to return back to their home or wherever they may be staying. And then we also have various programs such as RAP, so recovery wellness activities that are available at various libraries in the city. We also have a bunch of training and education purposes for people that may want to access that, or also for service providers. And then we do a lot of community collaboration around, our work is very guided by people with lived experience and living experience. And so we have a variety of advisory tables to help guide that work that we do. And I will throw it over the floor to MTS to explain what Taibu is.
Thank you, Sim. Again, Taibu TCCS has been in operation as a community health center since 2008. Taibu bases its principles in Afrocentric, minority-focused well-being principles, such as Ubuntu, African, Indo-Caribbean, and Afro-Caribbean principles. For example, Taibu itself means in good health, and as a community health center, we strive to make sure that our community is in good health. We've taken those practices and put them into TCCS as well. So for example, when we named our vans are named Imani and Umoja, which are Bantu principles that mean faith and unity. So every day when we send our vans out into the community, it's like we're sending faith and unity out into the community. So being that it is a health center, one of the smart things that the city did when they turn around and determine who should get these pilots is that they gave it to 4 health centers. Gerstein Community Health Center, Taibu Community Health Center, and I think it's also important to mention the other collaborative partners, CMHA, as well as Two Spiriteds. CMHA is in the northwest quadrant. I think we're going to do a map later, so I'll leave that, and Two Spiriteds is full GTA, but the map will show the full details about where the pilots are located. Now, with respect to Taibu, we do the entire Scarborough region, which is Steeles in the north, Rouge Valley in the east, Kingston Road, the beaches in the south, and as I tell my team, anything right of Victoria Park is right for us. So on the right side of Victoria Park, anything east of Victoria Park is our catchment area. Now, Taibu has a myriad of in-house services. such as NPs, NDs, RNs, GPs, a ton of counseling, one-to-one, individual, minority focus. We have a collaboration with SAPACY program, which works with CAMH. We have other organizations that we have a memorandum of understandings to provide other services. So, for example, we have an organization known as the Scarborough Community Legal Services that comes in once a month and does legal clinics that are free and open to anybody in the community. So anybody, this month's topic is landlord tenancy, which is huge. And so we have landlord tenancy law, free counseling, immigration law counseling, and various other types of counseling. We have psychiatry once a week, every week on a Wednesday. We have walk-in case management available on a Wednesday. We have a pharmacy attached to 27 Tapscott, where the main headquarters is for Taibu Community Health Center itself. And we have a ton of other services that are available, like community outreach program, a food bank, COVID response team for when we had the COVID situation, and an outreach team, as well as Taibu Eats and relationships with other organizations, as well as future expansions. So, yep, happy to provide that information about Taibu.
Thanks, Imtiaz. I wanted to touch base on the City of Toronto really found that people weren't getting the support they needed in the city around their mental health. And so that's why this project was implemented and piloted and then brought on full time across the city in July of 2024. So that was just recently. You may see some posters at the subway stations, bus stops, really advertising, letting folks know that we're here. Also, this is one of the key priority action plans under the Safe TO project. And yeah, I'll switch the page. So what is TCCS, or Toronto Community Crisis Service? So we're a 24-hour, 7-day program. So we operate on stats, everything. There's no wrong approach. You can access us by multiple pathways. This is all voluntary and consent-based, so really it has to come from the individual. A referral can be made. We can go out and see the individual. However, they can decline at that moment. But however, if they want service and are open to it, we definitely can continue with that. We come from a trauma-informed and harm reduction lens. We have multiple mobile crisis teams across the city. So all our vehicles are marked with the crisis symbol. So you can see on the bottom the Toronto Community Crisis Service logo, and as well whatever anchor partner, so whatever organization is working in that within that catchment of the city will also have their logo. We also have culturally relevant services. So we have worked very closely with the anchor partner of Two-Spirited People of the First Nations, and they offer an Indigenous response. Also, our teams are very diverse and made up of various cultures and languages, and able to support folks if that's something that they're looking for and feel more comfortable in. And in addition to that initial crisis response, we do offer 90 days of post-crisis follow-up care. So not really case management, but follow-up care in the sense of we're able to make sure that we can link the individual to various services in the city that they're currently looking for and check onto them till that warm transfer can happen for longer term continued care. Imtiaz, I'm not sure if you'd like to add anything there.
With respect to catchment areas and different types of models, yes, we do have a very diverse team. As I said, Taibu focused on Afrocentric type of minority type wellness implementation, and we have a diverse team. We have teams members that speak Swahili, Kikuyu, Urdu, Hindi, Punjabi, Farsi, Arabic, French, Yoruba, Igbo, Tamil, and we are currently looking for Cantonese, Mandarin, Tagalog, and Spanish.
Thank you. Here's a high level map. So you can see everything that is in the dotted line is Two-Spirited People of the First Nations covering citywide. So when you are making that referral to our dispatch partner, which we're going to go through, you can ask for an Indigenous response. And so that could also be offered there. The lighter green is the Gerstein Crisis Centre. So we currently operate within 51, 52, 53, 55, 11, 13, and 14 and 22 division in the city. So that's the lighter shaded green. The darker green is CMHA, so they do everything north of the city. And then I'll let MTS speak on the light green of Taibu's catchment.
Yeah, so as I previously mentioned, Steeles is our northern border, Rouge Valley is our eastern border, the Beaches Kingston Road is our south border, and our west border is Victoria Park, anything straight across the line of Victoria Park. Now, the Two-Spirited Nations of the First People does the entire GTA for anybody that identifies as Indigenous, so they can encompass any of the catchment areas. But with respect to Taibu, we cover 41 Division, 42 Division, and 43 Division, as well as the major hospitals in the Scarborough region, like the Centenary Hospital, Birchmount Hospital, and Scarborough Grace Hospital.
Great. And so as I was speaking before about our 211 dispatch partners, so the way that referrals work are you can call 211, nice and easy phone number to remember, and you will get in touch with a service navigator, and they will grab some information from you around who you're trying to refer, who are you concerned about. You may not know the name, and that's okay. They might ask you for some demographics so we can identify the person, where they're currently at, and what are you experiencing and what are you seeing. Thanks, Mary. I see your I have lots of screens going on, so I just see your little comments in the chat. So thank you, Mary. Yes, it's a very nice, easy number to remember. And also 211 can also offer lots of different supports around food bank meal programs, kind of referrals, anything that somebody may be looking for. Imtiaz?
Yeah, so as we said, 211 is the number that you can call to obtain a trauma-informed de-escalation mental health pair of professionals that will come to the scene. They will turn around and be dispatched by our 211 navigator, and then they will attend, service, support, diffuse, de-escalate, uh, transport to hospital if necessary, make any additional referrals for short-term or long-term care, and then follow up. So for example, at Taibu, we have a 3-month bridging program so that it's not just a one-off, and every time this person experiences a crisis, they call 211 and then just have it immediately handled, but with no follow-up plan. There's always a follow-up 48-hour call, and there's always a referral possibility to the in-house case management team that will bridge them to a long-term case management team and help them with things in the meantime, for example, like the paid ID clinic, Service Ontario, Ontario Photo ID card, health card, and various other types of things that they can get them prepared to transition over to long-term case management and care. Aside from that, it's important to note that Taibu TCCS and as well as all the TCCS members offer the services of trauma-informed de-escalation as an opportunity that was never previously afforded. For example, this program came out of a lot of pain and a lot of tragedy that happened for individuals that weren't afforded the program before. So Regis Korchinski Paquette, Sami Yatim, Brother Nadim in Mississauga, and various others. And so now the point is that this program is here, it's available, and it is an option. It is non-police led and non-enforcement based, and offers you a team of 2 trauma-informed de-escalation mental health specialists. Now, that is not to say that 911 can still be called, because muscle memory denotes that people will still call for 911, as 911 was the only source of recourse you had to call for any type of crisis before. So now you can still call 911, and it will be determined and screened for 3 criteria that I think we're about to go through. So I'll leave that for us to go through on the slide. But the 3 variables and main criteria are going to be mentioned just now. Aside from that, though, is that you can call 211, and then we have another policy in which officers and or the community or our members can do what is called an in the community and access a team to be dispatched if we come across a secondary client, or if we're on road doing outreach and see a crisis, or if one of our in-house teams turn around and tell us that we have a crisis.
Yeah.
Thank you.
Thanks, MTS. So some of the calls that we may not be able to respond to are some not that are violent situations or threatening active suicide. However, if police do show up and attend those calls, we definitely can do a co-response. And so once it's deemed that the person is not a harm to themselves or others, we can also support the person in that crisis situation. And so we're always open to that collaboration with other services. So just this is a high level service map. I know MTS had gone over it a little bit. I've gone over it a little bit, but here it's a nice way to visualize like how the calls come in. So they can either come through 911 or 211 or other crisis lines like the Gerstein Center. The calls are triaged if they go into 911 and to really see if a TPS response is not required, and that consent, then that phone call is sent over to 211 to those service navigators. 211 completes an assessment with the caller. So that caller could be for yourself or it could be for somebody else. Then that call is then sent over to the appropriate anchor partner, which is within the geographical area that you're requesting that service. A mobile team is sent out. The mobile team arrives on site. And then we offer a follow-up support within 48 hours. And so that can be by phone call or in-person visit, whatever the person identifies. That we really believe in folks' autonomy and the right to make decisions. And so we go with that and their direction. MTS, do you want to speak on this one? Training?
Sure. Training is very intensive. Is now went from a 5-week to an 8-week full course of training that everybody that wants to become an MCT, a mobile crisis team member, part of the TCCS, skilled in trauma informed de-escalation services, has to go through and complete in order to become a MCT. And some of the foundational principles and courses that are involved in this is harm reduction, trauma-informed care, staff well-being, and awareness and resilience panel for people with lived experience and family members of those who have participants in inquest, panel hosted by voices from the street centering experience on mental health system. Some of the core courses and skills, are the crisis intervention, like CPI, service intervention, like assist, suicide prevention, pharmacology, communication skills, community safety strategies like physical skills, understanding managing aggressive behavior, ESR, like effective specialized responses, violent threat risk assessment, standard operating procedures, 211 dispatch, radio technology, and first aid CPR, psychological mental health first aid, and naloxone training, as well as various other intricate parts like FIPA rules, regulations, and understanding, Mental Health Act, DSM, documentation skills. I mentioned pharmacology, focus tables, spider tables, MCIT, 211 information and referrals, and the list goes on. So there is a ton of training that goes into it, and we usually pull people from professions that are already been in the industry and working around these types of topics. So like shelter workers, shift leaders, safe bed workers, case management workers, hospital workers, PSWs, RNs, social workers, nurse care workers, community justice workers, criminal justice workers, and lived experience workers as well. So one of the main features of the program is that at the end of after you've completed all your certifications in different areas and completed all the core courses as well as the elective courses, you will turn around and do a scenario-based training in which they are paid actors that come and perform situations where they are in crisis, depicting a person that may be suicidal on a ledge or at a platform at a TTC subway station, a person that may be suffering from psychogeriatric mental health issues that is wandering and doesn't know how they got where they are, schizophrenia affective, or an individual who may be facing the fact that they're hearing audio and visual hallucinations, a depressed person who's not willing to leave their home, and things like that.
Thanks, MTS. Also, there's going to be plenty of opportunities for ongoing professional development as staff are really encouraged to suggest areas, topics for further learning. Also, there may be topics that we may not covered and uncovering as we're going out on these calls. MTS?
Yeah, and I'm really glad you mentioned that, because one of our favorite courses to continue our education of our staff is through Shikabe Makwa, in which we have a lot of our staff take the Indigenous Helper Program Part 1 and Part 2 because they do receive a CAMH certificate, and it is an Indigenous focused helper program. And there are other special workshops and networks through the Shikabe Makwa that we often reference. We do community of practices as well, in which each individual anchor partner is tasked with creating a special training on an area of need that may have not been covered. And so we did first anti-Black racism, ABR, and then we also did ESR, which is effective specialized responses, and creating the most effective circle of care.
Thank you so much for adding that in. Yeah, so we're always reevaluating, redeveloping our training criteria and adding things as we go along. Um, we're going to just change it up a little bit and just talk about how we like to uphold confidentiality and autonomy within how we present ourselves. And so the different ways that we identify, staff identifies themselves to service users vary from anchor partner to anchor partner. So for the Gerstein Centre, as you can see that lanyard on top, that's the way we identify ourselves. All our workers are trained to identify themselves, what position they hold, as well as what organization they're coming from, are representing. Also our vehicles, as you can see in that back of that image, just a small decal on the window of our, that we are a crisis service. And so no matter what, we'll always have that ID, and people and our workers are able to identify themselves. Imtiaz? Oh, Imtiaz lost his volume.
I'm sorry, I have it back.
Okay, great.
That would help if I unmuted. Yes, but as I mentioned, we are a non-police led, non-enforcement based response program, trauma-informed de-escalation response, and the team attends in civilian clothing. Sometimes they'll have a TCCS marked attire, like a hat, sweater, jacket, shirt. But the key piece of identifying marker is their lanyard with their badge, and the point is so that it is a civilian based program led by our community for our community.
Thank you. And here we're going to just talk about our program data from the 1-year evaluation. So that's from 22 to 23. It's a little outdated, but we're currently in the works of reevaluation for the previous year. So for this pilot, so this is all based on just on the pilot project. So this was not citywide. They received just over 6,800 calls, and just over 5,800 of those were mobile teams that were dispatched in relation to those calls. It took us about 25 minutes to travel. And of course that varies, you know, the city, as everybody knows, the city of Toronto traffic is not the best these days. So sometimes depending on that, it may take a little longer, a little shorter, just depending on the geographical area. The average that was spent with the individual was 30 minutes. There was 78% of calls that were diverted from 78% of calls transferred from 911 that were handled by TCCS with no police involvement. And so that's a huge number. We're really proud of that. 8% of the total calls of those 5,800 visits resulted in a hospital emergency room visit. That could be self-asked. So the person that we're serving could be like, hey, you know, I'm really not feeling well. I really feel like I really need the support. We're able to support the individual in that and get them to the ER. Sometimes ambulances are requested. So that was 1.7 of the total calls, and police attendance requested was 2.2. So if our team members arrive on scene and realize it's out of our scope, say that, you know, they're threatening suicide or have a weapon, that's outside our scope, and that's when we would call for police support. And then connecting to community-based services, that 4% were resolved over the phone, providing information and referral services. So sometimes folks would not like the mobile team, and we can provide that support over the phone. 441 outbound referrals were made, including shelter beds, crisis beds, and EMS services. And almost 2,000, there was follow-up around referring to mental health, substance use, and housing supports. And then just over 1,100 service users were connected to case management supports in the city. MTS, I'm not sure if you want to add anything here.
No, I think this is a pretty extensive list.
Yeah.
We do keep try our best to keep as much data and analytics as possible, as data is king. And when it comes to the city and funding, it's always important to keep a lot of data. So we have implemented things where we can also keep track of demographics, social outcome, well-being, even up down to the donations. So for example, we were able to give out something like 20,000 grains in 3 years, like rice, barley, pasta, chickpeas, red lentils, green lentils, and kidney beans. That's 7. And 5,000 hygiene kits, and something like 500 cases of water, 2,000 pairs of socks, things like that. And we're able to click on touch points and keep track of every single thing that we give away. So if we see a client and we give away 1 sleeping bag, 1 granola bar, a bottle of water, and a McDonald's gift card, we're able to keep track of that now as well in terms of even donations, on top of all the other demographics that have been presented here today.
And so how can we help? So really spread the word of what TCCS is. Share it with your colleagues, your friends, loved ones, whoever, teachers. Also, you can also call TCCS directly. So we get a lot of phone calls of people on their way home from work saying, you know, I see this person, they appear to be in distress. You know, they appear to be yelling. Just for example, really, can you come out and see them? The caller gives some identifying markers that's dispatched to us, and we're able to go and follow up with the individual.
Yeah, it's important to note that this could be anybody, your aunt, uncle, cousin, brother, coworker, classmate, um, nosy neighbor, anybody in the community that just may be having the worst day of their life and having an episode or having a crisis. And it could be for any reason as well. Maybe they lost their job, maybe they're facing immigration issues, housing security issues, food security issues, all different kinds of things. That could be a factor as to what is going on as times become tougher. Economics play a factor, and various other things. So it's more important to note that, and that anybody can face crisis at any time. And then now there's a number where you can call 211 and get a non-police led trauma-informed de-escalation response that will help to be proactive in helping this person. I was with the Ministry of Attorney General and the Toronto Bail Program for about 17 and a half years, and it would break my heart that people would get help after they entered into the criminal justice system, because now there's all this mental health and justice services that are available to them because they're facing criminal charges. And so I left when this opportunity came about to be a part of something that is proactive and helping people not enter the criminal justice system and not rack up administrative charges for fail to comply or fail to attend or things like that, in which now they can get service support and possibly get attention, help, psychiatry, therapy, medication review, referral for support, case management, and whatnot before it gets to that position, right? And that's the key factor that I think this team is working on. And I'm so happy to be a part of the TCCS. And I think anybody who uses the program will be very, very happy to see that this is something that now was never afforded before and now is available and as is an option.
Yes. And if you want to reach either one of us, we're more than happy to answer some questions, of course, in this presentation, but as well as if you have any afterthoughts. So I'm Sim Shukla, and then there's Imtiaz's contact as well there, and feel free to reach out to either one of us.